and welcome to the Fox 26 Newsroom. I'm Kim Stevens, and today we are talking about hair loss. And it's not just something that happens to men going bald, and it can happen to women as well. So what we are going to do is find out not only who it could happen to, how it can present itself, but also maybe if there are any ways we can either prevent it or treat it once it does happen. I'd like to introduce Dr. Rohini Shantharam, who is with us this morning, who is an expert in this field. Thank you so much for being here today.
Thank you, Kim. Thanks for having me.
So usually we think that hair loss is a thing that happens to men, and they end up losing hair, going bald, sometimes at a pretty early age, but it's not just a men thing, right?
Yes, so hair loss can occur to both men and women, and we see it more frequently than most people expect. There can be different forms of hair loss. We can see it in hereditary forms. So when we hear about male or female pattern hair loss, that's typically what that's referring to. But we also see it from conditions happening internally, such as thyroid imbalances, metabolic abnormalities, physiological stressors on the body can cause hair loss. For example, post-pregnancy, post having an illness or a virus. We saw it with COVID. They termed it COVID hair, but it was very similar to the form of hair loss that occurs after the body has gone through some form of stress. And then we get a delayed form of hair loss that occurs that transiently can happen where the hair will regrow. So lots of different forms of hair loss that we typically will diagnose, and we can make ways of treating.
You said something, though, that really does make someone's heart skip a beat, and that is that it can regrow. So let's talk about how that can happen. Like, let's say after an illness or your body has gone through some sort of traumatic event, is it just patience that you say to your patients, don't worry, it will come back? Or is there something to do to kind of stimulate that?
Yes. So, first and foremost to our patients, we want to provide accurate information and make sure that that's what's truly going on. So diagnosis is key. We evaluate the scalp. Sometimes we'll do a biopsy if we have to further prove what's going on at the level of the hair follicle. And sometimes we'll even check lab work. Once we've diagnosed it accurately, we can then, if it truly is that form of transient hair loss called telogen effluvium, which is a delayed onset. It will occur 3 to 6 months after whatever insult was made on the body. So it's delayed. And sometimes we have to jog our memory because we forget what happened 3 to 6 months. I'll ask patients, were you hospitalized? Did you have a surgery? Even if it was an elective one, the body is healing. And so the hairs will shift in the growth phase into the resting or shedding phase. And so we'll have a larger proportion of hairs shedding. Although we are typically daily losing on average, normally 100 to 150 hairs, that will increase in proportion. And so then it will feel like your hair is coming out in clumps. And that slowly will calm down as the body is healing itself. And so we're able to tell patients that if there is an underlying metabolic abnormality, such as low vitamin D or zinc levels or iron levels, or thyroid imbalances that are stimulating this form of hair loss, treating the underlying cause itself is what's truly going to help the hair regrow. But along with
what about I'm sorry, go ahead first.
Oh, I was just, along with that, we do have ways of pushing the hair forward and stimulating and boosting growth. But, we do it within reason once we know we have the appropriate diagnosis, because there are other, primary forms of hair loss that are from, situations within the scalp, whether it's inflammation causing a dermatitis within the scalp and affecting the hair follicle, or autoimmune related conditions where our body is producing immune cells to fight the hair follicle locally. We have to then approach it in the most adequate manner so you get the best treatment.
Okay. Yeah. So I was going to ask then the things that can attack the body or that are happening in the body that not only lead to hair loss, but then the loss that where the hair cannot regrow? What do you do then?
Right. So those forms of hair loss are called scarring conditions. So it's scarring hair loss. So we kind of categorize it. There are certain inflammatory conditions that can result in a form of scarring hair loss, whether it is from a form of lupus we call discoid lupus, or a form of hair loss that we see more predominantly in middle-aged women, called frontal fibrosing alopecia. We are evaluating the scalp. We take a biopsy. We can see that pattern of inflammation. And the key with that is to treat it a little bit more aggressively, treat and calm down the inflammation so that the inflammation subsides and further hair follicles are not damaged and injured. Once that occurs, it is very hard to regrow hair within a scarred follicle, because the follicle, that's where the stem cells for the hair kind of align. Once that is damaged and injured away, it's really hard to kind of regrow that. And once a scar happens anywhere on the body, to get the healthy skin to come in is very, very hard. And so those are conditions that we are very, as dermatologists, it's very important for us to diagnose early.
When you say treatment, what kind of treatment is it? Pills or liquids or shots or?
Exactly. A combination of different forms of treatment. Depending on, again, the diagnosis, we will sometimes start with topical therapy, which can be in the form of shampoos or solutions that are used at home that we prescribe from the pharmacy. We will, in combination, sometimes do injections of local, immuno anti-inflammatory steroid, which we call Kenalog. And then sometimes we'll start oral pills, and the pills are a wide range of different kinds, from pills that affect for women who have early onset female pattern hair loss, affect the sensitivity of the hormone receptor within the hair follicle to calm down and not stimulate that form of hair loss, to medications that help calm down autoimmune disease, to medications that help to dilate the vessels around the hair follicle so that we can get blood flowing, and nutrients to the hair follicle. Some of those come in the form of pills. And then once we can sort of calm down things that are going on from a primary hair loss standpoint, we can then consider some of the more regenerative forms of, PRP or low level light therapy or red light to help stimulate or boost new hair formation. So it's a little bit of a, systematic approach, because we can't just, we never want to just throw so many things at the problem, not knowing what we're treating and if it's working. So it's a really personalized approach. And I think it just requires time with the patient, diagnosis, and understanding the pathophysiology of hair loss.
It's such a personal thing when someone starts to lose their hair, and there's this sense of losing a sense of self, and just feeling then crummy about oneself when you look in the mirror. And now all of a sudden I'm seeing so many on social media, so many ads on, oh, the shampoo is really great, I have so much volume. What do you say? Because when you're in a low point like this and you're feeling really low about yourself because your body is changing and you don't like it, it makes you feel less than, or your self-esteem starts getting a hit, and you see these ads on social, there is a tendency to just jump and try everything. What do you say to people in that situation?
I fully agree with the concept that, there's a lot being marketed out there for not just hair loss, but skincare. As a physician, we really like to do treatments that are, backed by science. And so I always have my patients come in. There are certain things like, for example, over-the-counter Rogaine, which is, you can find it at Costco. It's what we call topical minoxidil, and it comes in a foam, it doesn't have a solution. That has been backed by science, and we do actually recommend it for most hair loss conditions. But the shampoos and things that are out there on Instagram, I tell my patients, save your money. Let's start slow and let's do treatments, even the treatments that have been studied The efficacy of those in different patients will vary because of the nature of hair loss. It's very complex, and it's not as black and white as treating a rash like psoriasis, where we have a lot of research and data. We're still learning a lot about hair loss. So I say, take things with a grain of salt. If someone's using something and they feel like it has thicken their hair and they're feeling better about it, I never say to stop it unless we feel like it is truly detrimental. For example, chemical dyes, hair dyes, we know that causes hair breakage. And if someone's coming in saying my hair is it's not growing as long as it used to, we may have to take a back step on something like that. But I think overall, it's really coming in, getting it diagnosed, looking at labs, seeing what may be going on internally. And we see it, patients who have done fad diets, for example, they're losing weight, whether it's medical weight loss or they've done it on their own with extreme dieting. We see forms of hair loss that are stimulated later on because of metabolic or nutrient imbalances. And so it's getting some of those things back in line. And we say, save your money, let's work on that, and then sort of decide what the next steps are.
Is there something that we can do as younger women to maybe try to prevent hair loss, like wearing less tight barrettes, or not having our hair pulled back really tight in a ponytail? Does that really have any effect?
So there are forms of hair loss we call traction alopecia that can be stimulated for frequent, constant use of the tighter braids and barrettes from a younger age. And it's a little bit more common in certain ethnicities that have, curlier hair. The tugging and the pulling on the hair follicle will create some inflammation through time that eventually will cause some damage to the hair follicle. And when the follicle gets enough damage repeatedly, it will sometimes scar away the follicle. And we will see, for those who wear tight ponytails, that they're unable to grow hair later on. We see it in the 30s, 40s, 50s of the frontal scalp because of that very condition. But I mean, we wear it, and it's for people who are really wearing tight braids, tight ponytails every single day. Take things within reason. So most people are, going to live their day-to-day life. There is definitely a component of hair loss in general that is hereditary and genetic. So no matter what you do, if you have had a parent that lost hair earlier on, that may be the course for you. And so to keep it in mind with just living a healthy lifestyle, making sure that you're eating a healthy diet, providing your body with healthy nutrients, those are going to be the most important things to do.
So do we look at, like, for women, because I always get confused about the men. The men say it's the baldness on the mother's side, but when dad's bald and the son's bald, that doesn't seem to, it's hard to understand. Is it like that for women also?
We don't know the exact genetic link or where it truly falls within the bloodline, I would say. I think that there's definitely a component, when we think about both male or female pattern hair loss, it could, skip a generation, or, what it may be. We see it vary across the board. So that part is hard. I think the biggest thing is when we see signs of it early on, whether it's in your 20s or early 30s, to kind of talk through it and see what some of the options are. But it's, when you have a child and that, your husband or your parent, balded earlier on, it's hard to kind of predict what will happen because we just don't have that genetic link yet.
Yeah. I am now of the age of menopause, and I am seeing women say that their hair is changing. What do you say to women who are noticing not only their hair, but it seems like everything is changing?
Yeah, so hormonal changes for women on the body occurring throughout the different stages of life can be hard because it's the transitions, right? The changes that we don't know how to control. What do we do? For, perimenopause, menopause in women, we do see there is a little bit more hair loss. We typically see it, and we'll, kind of call that in, female pattern. So we see it as a little bit of hair loss within the temple. We see it as a little bit of a diffuse thinning throughout the scalp, a widening of the hair part, and miniaturization of the hair follicles. So it means that you won't have as thick a ponytail. You may not be able to grow hair as long as you once did. The hair texture and the shininess may change, which are changes within the hormones. And then the hormones also play a role on the skin as well. So we have treatments and things that we do to prevent how, aggressively we're seeing these changes. Some of these are the processes of aging. So, that's a process of this hair follicle aging. The skin texture and the changes are the processes of the skin aging. And so the regenerative treatments that we sometimes do can help stabilize or prevent that from occurring as quickly. But we like to set our expectations and be honest about how much we can provide with treating these.
Yeah. And what about women who have gone through chemo? Many times they say that their hair has come back and it is so different, but and maybe sometimes patchy. Do you help women who are post chemo?
Yes. So we truly do see, hair loss. We call that anagen effluvium. So we categorize this. So we have different names. Telogen, we mentioned, for hair loss that's delayed, that occurs after, physiological stress on the body. When patients, both men and women and children, have undergone chemotherapy, it causes a halting of the cell turnover, not just for the cancer cells, but for the skin cells in the body, the gut cells, the nail cells, the hair cells. And so all of these, the chemo will play a role in all of that. The hair will shed, and we call that, and it affects those cells that are dividing most rapidly. So the cells that are in the growth phase of the hair cycle are dividing most rapidly, and that's what's going to be affected by chemo. And so it will fall. The hair will regrow a little bit differently. We see that. Sometimes it may be thicker or coarser. Sometimes you may have had straighter hair when you were younger, and then post chemo, the hair regrows curlier or thicker. It's hard to predict how that's going to change for each individual, but we do tend to give options for patients if they choose to wear a wig. We do remind them that the hair will grow back. It's not a scarring form of hair loss. I think that's something that they hold on to when they're going through such a vulnerable stage of their life, which is nice to remind them that the hair will grow back.
Well, there certainly are an awful lot of resources out there in terms of wigs, or even partial wigs, I guess, little, things that you can add to your hair to maybe add some fullness or cover some thinning. Now it seems like it's more popular or more readily available, right?
Yeah, I think as the cultural changes, we definitely see it within patients who don't have any hair loss conditions, getting extensions and things like that. So we, a lot of what we do as dermatologists is treating, skin, hair, and nails. We want patients to have their confidence and live a happy, healthy, fruitful life. So we give recommendations for those things. And I think it's a great option. And then tell them, and just be honest. Again, I think there's been a lot of marketing with a lot of, hair care, skin care. And most of my patients come in just wanting to know, is this going to work? And when, I have to sometimes say no, but they'll thank me for just being honest. And I think that's the biggest key with a lot of what's going on within this realm of, the skin, hair, and nails.
Finally, is there one thing that women do that you say you should not do because that's bad for your scalp? Ultimately, it's bad for your follicles.
Yes, we do. We notice, hot combs and perming of the scalp over time creates a lot of inflammation or damage, which, it's not done as, frequently now, but we know that did stimulate a form of hair loss in certain ethnic types, later on in life. And we have good data on that. As far as, hair loss conditions, again, I think that what's going on within the scalp, we are going to diagnose whether it's something internally related or something autoimmune like alopecia areata, and that we will have to make a treatment plan for. But just general hair care practices and keeping the scalp healthy, a lot of it's just, avoiding the harsh chemicals and dyes. If you're truly wanting your hair to grow and be healthy, you're going to want to try to avoid some of those. So we do talk about that. And sometimes we see forms of what we call contact dermatitis from certain kinds of hair dyes repeatedly. And so it's creating, your body doesn't like the dye itself. And so as soon as you dye your hair, you're done, they come in with a red, scaly, itchy scalp. And if you're getting your hair dyed, every 6 to 8 weeks, it's becoming chronic and recurrent. And then now your hair is starting to fall out because of all that inflammation. We do have to say, you're going to want to avoid, or maybe we have to start figuring out what specific ingredient in the hair dye. For some, it's PPD or paraphenyl diamine that are in darker dyes that can cause this sort of a situation. So we kind of have to tease it out at that point.
Okay. Dr. Shantharam, thank you so much for your insight today. Is there anything else that you want to share with our viewers that I neglected to ask you about?
I think overall, the most important thing with hair loss conditions is we consider it a medical condition. So, before you jump to the ads or, the marketing online, consider seeing a doctor, whether it's a dermatologist or even your primary care physician, to make sure that you are healthy internally. That's the biggest, most important takeaway, that you're getting your age appropriate screenings to make sure that labs are within normal limits. I think that's the biggest thing for us here as doctors. It starts with that step. And then if the primary care doctor, has teased out a few things and isn't sure of the next steps, then they'll send the patient to us and we can kind of go into it a little bit more in detail. But that would be sort of my takeaway.
Yeah, that's a really real important one. Dr. Shantharam, thank you very much for your time today. Really appreciate it.
You're welcome. Thank you so much for having me, Kim.
Hi, I'm Monty Torres with FOX26 News on YouTube. Thank you for checking out our YouTube channel, where we have loads of great content for you to choose from. And while you're here, why not click on the subscribe button right here? That way you can stay in touch with all the latest breaking news, everything news related within the Central Valley. And thank you for watching.